The following is brought to you by Arkansas Surgical Hospital.
When it comes to patient care, keeping readmission rates low is a key indicator of success, and Arkansas Surgical Hospital is leading the way. It has been named one of the top 10 hospitals in the U.S. for the lowest readmission rates and the only hospital in the state to make this list. So Dr. William Heffley, an orthopedic surgeon, is here to explain what this means for patients. Dr. Heffley, thank you so much for joining me, and congratulations to Arkansas Surgical Hospital. This is a huge deal.
Well, thank you very much. We're extremely excited about this. This program is called the Hospital Readmission Reduction Program. It's an effort put in place by the federal government through CMS, Centers for Medicaid Services, and what they are doing is they want to improve healthcare in America by linking the payments to hospital to the quality of care. Essentially, hospitals that have excessively high readmissions are penalized, their payments are reduced.
So what did y'all have to do to even get determined as a participant in this, I guess, to qualify for this award?
Sure. The government collects data all the time on all the hospitals in the United States, thousands of hospitals, millions upon millions of patient admissions, and then they track how many of those patients are readmitted within the first 30 days. And an unplanned readmission is not a good thing. You know, when you go to the hospital, you obviously want the best quality of care, and when you're deemed well enough to go home, you want to be at home, and if something goes wrong and you have to come back, that's reflected as a poor indicator of care. So they analyzed data for thousands of hospitals, and this was not something we were behind. We just started reading articles that the top 10 hospitals in the United States were named, and we were actually number 5. We're the only hospital in the state of Arkansas. We're the only hospital in the southeast region of the entire United States. Hospital for Special Surgery in New York was number 1. We're number 5. So I guess we got to work to get to that top 5. But out of several thousand, we're very happy about this.
What is different at Arkansas Surgical Hospital to help you get this recognition?
You know, this hospital was envisioned by a group of surgeons about 20 years ago, and we felt like, as surgeons, as healthcare providers, and all of our training experience in healthcare, we might be able to deliver a better quality of care. We wanted not only the best clinical outcomes, the best surgical outcomes, but we also wanted a better experience for patients and their families. And I think an award such as this is validation that our steady commitment to care over 20 years has come to fruition. We're having some success.
What kind of feedback do you hear from patients about their time at Arkansas Surgical Hospital?
That's probably the best part of my job. We get to see all these patients, and I've been in experiences where patients are very unhappy and they complain a lot. It's unpleasant. We want to deliver the best. We want to be the best. And at Arkansas Surgical Hospital, I see my patients there every day. And every day, I have multiple patients tell me, this is the best hospital I've ever been in. And people just have a great experience. We designed the hospital from the physical plant. Each patient room is a suite. There's a family area. There's a patient area so the patient can rest, the family can talk or sleep. But, the team we have there, we have a great anesthesia crew. A great group that does that, great preoperative screening, but great surgeons. But it's all the nurses and the staff from the preoperative area, the scrub techs and nurses back in the OR, the postoperative care. Everybody is on the surgical team. They do the same thing all day, every day, and they're very, very committed to producing the best possible results and to do it in a friendly, compassionate way.
What does this mean to the faculty and staff there at Arkansas Surgical Hospital? I mean, the sense of pride I'm sure you have for this is beyond words.
Well, I'm very blessed to get to work with the same people every day, and they're all so good. And, this is a strong recognition of their commitment to excellence. And I think I couldn't be prouder of them. This couldn't be done. Good surgeons can't do this by themselves. You got to have the right crew. And the fact that we do the same thing over and over and over and over makes people, gives them a level of expertise, and we train carefully and we select our people carefully. So I'm sure it's a sense of pride to them, and I want to give them a big shout out today because, they mean everything.
Well, you have a bit of personal news to share that your practice is making a big move. What do we need to know about this?
Yeah, we're very excited. We are building an office. It's almost completed. We were moving furniture in yesterday. It's going to be right across the street from the hospital. So, our surgeons will come to work in the morning, park one place, and work back and forth, and can be closer to our patients. And it's a, nice facility. I think it's got, state of the art with all the latest stuff in there. So I think it'll be good for the patients. Just one more, enhancement for the patient care.
Perfect. Thank you so much for joining me today, and congratulations.
Thank you very much.
All right, well, after this break, Get Down Downtown is happening this weekend in Searcy, so we will be getting all of the details on the food, music, and fun. That's next. Stay with us.
Attention, Central